All you need to know about hantavirus. Hantavirus is a rare but dangerous virus that spreads mainly through rodents such as rats and mice. Although many people have never heard about it, hantavirus can cause severe illness in humans and may even become life-threatening if not treated quickly. Understanding how the virus spreads, its symptoms, prevention methods, and treatment options is very important for protecting yourself and your family. What is hantavirus? Hantavirus is a group of viruses carried by certain rodents around the world. Humans usually become infected when they come into contact with the urine, saliva, or droppings of infected rodents. In some cases, the virus can also spread when people breathe in tiny particles contaminated by rodent waste. The disease caused by hantavirus depends on the region of the world. In North and South America, it commonly causes a severe lung disease known as hantavirus pulmonary syndrome, HPS. In Europe and Asia, some strains cause hemorrhagic fever with renal syndrome, HFRS, which mainly affects the kidneys. Although hantavirus infections are rare, they can become very serious within a short period of time. How does hantavirus spread? The virus does not usually spread from person to person. Instead, it is mostly linked to contact with infected rodents. Common ways people become infected include sweeping or cleaning rodent droppings without protection, living in places with heavy rat or mouse infestations, eating food contaminated by rodents, touching contaminated surfaces and then touching the mouth or nose, camping or staying in poorly cleaned cabins, being bitten by an infected rodent, though this is less common. People who work in farms, forests, warehouses, or abandoned buildings may have a higher risk of exposure. Symptoms of hantavirus. Symptoms often begin between 1 and 8 weeks after exposure to infected rodents. At first, the illness may look like ordinary flu, making it difficult to recognize early. Early symptoms. Some common early signs include fever, headache, fatigue, muscle aches, chills, dizziness, nausea and vomiting, abdominal pain. After a few days, the condition may suddenly become severe. Severe symptoms. As the disease progresses, the lungs may begin to fill with fluid, causing shortness of breath, severe coughing, chest tightness, difficulty breathing. In serious cases, the person may need emergency medical treatment or oxygen support. Without quick medical attention, hantavirus can lead to organ failure or death. How dangerous is hantavirus? Hantavirus is considered a very dangerous infection because it can worsen rapidly. Some forms of the disease have a high death rate, especially when treatment is delayed. However, early diagnosis and hospital care greatly improve the chances of survival. Unlike viruses such as COVID-19, hantavirus outbreaks are usually small and linked to rodent exposure rather than widespread human transmission.